Hello, everyone. Good afternoon. Hopefully you can hear me. My name is Julia Simpson. I'm a case manager with Advocacy Links, and I want to thank you all for joining us. Uh, this afternoon, we are doing a presentation on communication and dementia, care tips for professionals and caregivers, and Mary Bosch is our presenter. I'm going to give people a couple more minutes to log on, and then I will start official presentation of Mary's credentials, and then she will be taking over. So just give us a couple minutes. All right, it is officially 3 o'clock by my computer clock, so we're going to go ahead and get started. Again, thank you for joining us. You will be getting a confirmation that you attended this session. You'll get an email saying thank you for attending. So that will be your certification that you completed the training. Feel free to note any questions you have as Mary presents in the questions box, and we will answer those toward the end of the presentation. Mary comes from us where she works at Dunes Hospice. She graduated in 1988 from St. Joseph's College in Rensselaer, with a Bachelor of Science in Sociology and a minor in Psychology. She's worked in Illinois and Indiana as a certified, qualified intellectual disability professional. She also is a certified trainer for the state of Illinois to teach direct support personnel and QIDPs. She has worked in and monitored adults, children with disabilities in group homes, job training day programs, long-term care facilities, nursing homes, schools, and senior day centers. She currently is working at Dunes Hospice as a hospice liaison, which serves patients in Porter, Lake, Stark, Jasper, Knox, LaPorte, and Newton counties in Indiana. She presents to social workers, families, nursing staff, and EMS paramedics on the following: how to prevent falls, communication and dementia care tips, happy holidays and dementia. She is a certified CPR instructor through the American Heart Association. She is a certified dementia practitioner. She is the co-owner of Hands to Heart CPR, which teaches healthcare provider basic life support and Heart Saver CPR, AED, first aid. Hands to Heart CPR has 32 instructors who independently contract to teach CPR classes in Northwest Indiana and Illinois. So we want to welcome Mary and thank her for her time this afternoon. I am going to change my screen so that she can show her screen and continue with the presentation. Thank you. Okay. All right. Mary, are you seeing where you can get on with your screen?
Let's see. I'm looked at show my screen, but I'm not seeing it. Are you able to see it now?
Yep, can see it. Thank you.
Okay. Okay. Hi, everyone. Thank you for joining me. I look forward to teaching about communication dementia. I have been a certified dementia practitioner for 2.5 years now, in the field, of course, for over 10, working with families with dementia. So here we go. And please write down your questions and we'll definitely answer them at the end of the seminar. Okay. And just to let you know, the presentation is for educational purposes only, and the information is not intended to replace any type of information or medical professional diagnoses or anything like that. Oh, let's see, my screen. Uh-oh. It's not letting me advance to the next section. Hold on one second. Technical difficulties here. All right. I think we're frozen up here.
Uh-oh.
Yeah. Show screen. Let's try that again. Okay, I don't know why we're not advancing. Showing screen. All right. Hold on one second here. Because you see the main screen, correct?
Yes, I see the
Okay.
main, yeah, the cover page.
Okay. I am trying to pull up the next page, and it's frozen on the first page. Hold on one second. Let me see if I can get out of this for a second here. Show screen. All right, I don't know why we have all of a sudden lost the screen. Okay, Joy, any ideas on how to fix it?
I mean, we can try to switch it back to me and see
Okay.
if I can move it. I just need to pull up the presentation. Would it? Okay. Are you able to go back out and try to go back in, or?
No, it's not even letting me go back at all. Unless I maybe try and click out and go back in again.
Okay. That.
What? I'm sorry? I'm going to try that. I'm going to click out and try go back in again.
Okay. Thanks, everyone. Mary, you want me to try it from my end, or?
Yeah, because I put it back. I have it back up. So let me see if you could pull it up and be able to pull it back up again. I don't know what happened. We got frozen.
Well, okay. Okay. Oh, it has to be on your end because it's under you. Okay. All right. Let me try this. Let me go back to me.
Okay.
And show my screen, and then I will pull it up.
Okay.
And go.
Oh, okay, now I've been able to pull it. Okay, let's see.
All right. Can you
Okay,
see
can you see it now?
I got it on my screen.
Okay, can everyone see it now?
I've got your PowerPoint on my screen. Can you?
Okay. I just see the communication dementia care tips for professionals. It's your advocacy link screen is what I see. Hold on, let me see if I can. Okay. Yeah, that's what I see. Yeah, I see your initial screen. I don't see mine. But if now I'm going to pull mine up and let me know. Can you see it
You've got
now?
the statistics.
Yep.
Okay. Okay. What we're going to do, Mary.
Okay.
Okay. I've got your PowerPoint on my screen.
Okay.
So when you're ready to move, just tell me to switch to the next page.
Okay. Sounds good.
Right now, I've got the page that says statistics, understanding the problem.
Okay. Perfect.
Okay. All right. So we'll let you move forward.
Okay. All righty. So statistics, and understanding the problem, improved communication can help, and additional community tips. This is what we're going to be doing for our agenda today. Next screen.
Okay.
So facts, 30% of caregivers under 80 die before the person they are taking care of. And then the statistic goes up higher at 70% of caregivers over 80 die before the person they are taking care of. Reasoning behind that, of course, is because the caregiver oftentimes forget to take care of themselves, to eat, maybe take their insulin, or they don't maybe have enough sleep. So a lot of times the caregiver will pass away quicker. Next screen. So the next screen then talks about Alzheimer being the 6th leading cause of death in the United States. It's more than 5 million Americans are living with Alzheimer's, and by 2050, they suspect it's going to rise to about 16 million. Every 66 seconds, someone in the United States develops the disease, and currently it's 1 in 3 seniors dies with Alzheimer's or another type of dementia. Since 2000, deaths from heart disease have been decreased by 14%, but Alzheimer's disease has increased by 89%. It kills more than breast cancer and prostate cancer alone. And 1.1 trillion is what they suspect in 2050 that the cost would be for taking care of someone with dementia. 30%, 35%, and we talked about 35% of the caregiver people with Alzheimer's or another dementia report that their health has gotten worse due to taking care of somebody with dementia. 15 million Americans currently provide unpaid care for the people with Alzheimer's or other diseases. Next screen.
Okay.
Now, dementia, I don't know if everyone is aware.
There we go.
Dementia is actually kind of like an umbrella. So dementia is an umbrella that describes the collection of symptoms that causes disorders affected by the brain. Some of them is Alzheimer's disease, which is the leading one. It's 40 to 70% of all dementias are due to Alzheimer's disease. The other is vascular dementia is the next one at 15 to 25%. That is more related to different types of blood disorders, or sometimes too, it could be due to heart conditions. Lewy body is 2 to 20%. That one is not as pronounced, but that one is a little bit more behavior issues. There's a lot of behavior issues with someone with Lewy body dementia. Frontal temporal dementia accounts for about 2 to 4%. That's another one that is strictly towards the front of the brain, and that causes a lot of behavior issues as well. Other dementia is Parkinson's disease. Parkinson's disease often what they have dementia issues towards the end of the disease due to more brain tissue being affected. So a lot of times someone with Parkinson's disease will have dementia-like symptoms. Huntington's disease, sometimes there is also alcohol-related dementia where many of the brain cells have been affected and would cause dementia-like symptoms. Next screen. Memory loss. So losses that occur. So the normal brain is on top and Alzheimer's brain is on the bottom. So as the disease progresses, parts of the brain start opening up and affects the different things. So losses would be immediate recall. A lot of times someone might ask you, what's your birthday? What's your name? They may not be able to recall those different things. attention to selected information, such as birth dates or address or town that they live in, things like that they don't recall. Recent events. So if they went to a birthday party on Saturday for their grandchild, they may not remember that they did that. Or relationships. Losses of relationships often occur where they don't even remember their own spouse's name or children's names. Some of the abilities that are preserved are long ago memories. So a lot of times what happens is as the disease progresses, somebody will start remembering things from way back in the past. They'll remember when they went to school in 1925, or they may recall a favorite friend, or they might start remembering or not remembering what their home is currently, but they remember the home they lived at with their parents 40, 50 years ago. Emotional memories and motor memories are all preserved. One of the other biggest things that's preserved is music. So a lot of times somebody may not remember how to say their name, or they may not even remember or not even talk. But when music comes about, they often can sing the songs for word because they can remember music very well. Next screen. Understanding the stages of dementia. So for the early stages, ability to think of the right words, fewer topics, and speak less, and conversation is dull. So a lot of times in early stages, they have a hard time understanding words that you're saying, and they sometimes mumble their own words. So they may not understand what you're talking about, and sometimes they may not understand what they're saying, or they think they know what they're saying, but you can't understand it because they're jumbling their words a lot. The middle stage is knowing when to reply or vague. So a lot of times they may point to something or say something that may not be related. They may be pointing to a fork, and in reality they want a knife in order to cut their food, but they're using their fork in order to cut their food because they're not understanding that fork and knife are two different things. End stage is putting sentences together. Words may be lost completely, nonverbal, and also too, a lot of times they won't be able to tie their shoes. They may not be able to remember how to get in and out of bed. So many times during the end stages, they oftentimes will be bedridden. Next. How does communication affect a dementia individual? During the early stages of disease, people with dementia may have language problems, resembling forgetting words or using the wrong words, creating their own language sometimes. Individuals with dementia may lose the ability to read. So a lot of times they might just flip through pages, especially magazines, but they're not reading, and they enjoy looking at pictures more so because they can't understand the words and they can't read the words anymore. The ability to process language as well as formed speech may be lost. So what you're saying, they may not understand. They might be only getting selective words. So if you say a whole sentence, they may only catch a few words out of that whole sentence and misunderstand what you're saying. Individuals with dementia will understand facial expressions, tone of voice, and emotion. We'll talk a little bit about that in the next few screens over. Next. How do these things happen? Everything is affected. So thoughts, words, actions, and feelings are all affected. When it starts to progress, more brain dies over time. So as you can see, the top, that's a normal brain, and the bottom brain, all those things are affected. So you've lost parts of the brain. So as the brain dies over time, different parts of the brain get hit at different times, and not everyone's the same as to what part of the brain gets affected. There's constant changing. So for instance, there's times when they may remember something and other times they may not. A good example may be they can tie their shoes today but don't remember how to do it tomorrow. It is variable. So moment to moment is different at times. Morning to night can be different, day to day, and person to person. One day they can be great and remember everything, the next day not remember anything at all. It just kind of depends on what part of the brain is affected. It's almost like a cloud effect. When they're having a bad day, that part of the brain gets cloudy, and the different abilities, such as maybe talking to somebody or tying their shoes, gets affected. Dementia is predictable. There's specific brain parts, typical spread, and some parts are preserved, which, like I said, we talked about music. That's preserved. Next screen. What are the most common issues that come up? Not going to the doctor is one of the biggest issues. They have a tendency of forgetting that they had gone to the doctor, or need to make appointments, so they don't understand appointments. Losing important things. A lot of times they make a habit of losing things or putting things in different drawers, and that's the reasoning why. Some of my patients that I've had in the past have maybe taken their milk and stuck it in their sock drawer, or taken their socks and put it in the refrigerator, because they don't remember where it is, and then when they, or where it belongs, and when they go to find them, they'll say, I can't find my socks. They have a habit of getting lost. Unsafe task performance. So a lot of times when, let's say, they used to curl their hair, instead of them trying to curl their hair, they may use it and may grab it with their hands, or they may, when they go get their tea off the stove, they grab the, they grab it not with a, maybe a hot pad, and they'll just grab it, or grab something out of the oven without doing a hot pad, because they forget that they're supposed to do that. Repeated calls and contacts. A lot of times they have a tendency of, let's say their family member, like a son or daughter, lives away from home. They'll have a tendency of calling them often and saying that they lost something, or they may call them and get mad at them for not talking to them. But in reality, they do say talk to them a couple of times a week, but they forget and think they haven't talked to them in a very long time. They often refuse. They either refuse to take showers, they refuse to go to the doctor, they refuse to eat, because sometimes they often forget that they've done those things. Bad mouthing you to others. A lot of times, since they've forgotten about things, they have a tendency of saying, well, they never talk to them anymore, or they never come to see me anymore. So they'll tell other people that because they don't remember that they have seen you or have talked to you on the phone. They have a tendency of making up stories. A lot of times they'll do that to kind of mask that they're having some issues and forgetting things. I had an instance with an individual that we took them to a baseball game. And when she came back, she said her credit card was stolen because there was a big fight on the field and they took her purse and threw it over the fence. In reality, that didn't happen, but she got scared later on. We found out about the fact that there was the mascot that was playing around and goofing around in the field, and she thought it was a fight. So she was worried about her credit cards and worried about her purse, which she didn't have either of those things. But that was a time, that's what she thought was going on, was there was a fight in the field. Resisting care. They often are confused of someone having to take care of them because they're so used to doing it themselves. So they have a tendency of getting upset for you helping them because they think they can do it themselves when they have a hard time showering or remembering to wash their body or wash their hair. They have a tendency of making 911 calls because of the stories they're thinking of and thinking someone's in their home. They often become paranoid. Some of the other things are shadowing. They will often mimic the things that you do because they don't remember how to do it or they don't understand. Many times there's eloping or wandering. They'll often wander from the home or wander from places in the home because they don't understand that that's their home anymore. They don't remember it being their home. Oftentimes they threaten the caregivers because the caregivers are trying to help them, but they think they're trying to harm them because sometimes they start hallucinating, or they may think someone's hurting them, or they don't remember the caregiver because even if it's a family member or a caregiver that comes in the home that they've had for a long time, they don't remember them. They often feel sick. They strike others at times. There's a lot of falls and injuries, especially later in the dementia process, because they don't recall how to walk, how to get in and out of bed properly, get out of a chair, things like that, or to step upstairs or to step down the stairs. They often forget how to do those different things. They often don't eat or drink, and they see things in people. That's a lot of hallucinations they have. And they have limited mobility as the disease progresses. Next. Difficult behaviors often include any action that is unsafe, dangerous, destructive, and highly upsetting to self and others. We'll talk a little bit about more of that. Next screen. The key to communication is communication problems can lead to difficult behavior. Communication breaks down as the disease progresses. Like we discussed a little bit earlier, as disease progresses, they forget many things, so communication breaks down. Next step. So the different types of communication is verbal, oral, and written. Nonverbal is expressions and gestures. And often the little thing there says, remember, behavior equals communication. If they are not understanding something, they might have a behavior issue. They might not understand how to communicate. Next, So types of nonverbal communication can be your posture, your body language, eye contact, blinking, facial expression, smell, personal presentation, gestures, and pitch of voice. All those different things can include nonverbal communication. Next, negative body language. A lot of times when they're not understanding something, they might start rocking. They might have a rocking motion. They'll close their eyes. They're lowering of their chin. They start wringing their hands. They start clearing their throat. They start forgetting that there's grooming in there. They'll start yawning. So a lot of times they're trying to avoid you by doing these different things. When they start clenching their fists, they're getting very upset. They might start fidgeting in the chair. There's so many negative body language signals that someone can encounter with someone with dementia. Next screen. Caregivers can sometimes trigger difficult dementia behavior. We need to understand how our behavior and attitudes can impact loved ones' behavior. So we need to develop some new skills. Next screen. Changing our own behavior helps make caregiving more easy, effective, and efficient, and improve quality of care, safety, functioning, and moods. Next. Nonverbal communication. Individuals with dementia interpret our nonverbal communication as something relating to them or what's about to happen. They pick up on your feelings. They understand all types of nonverbal communication. One of my biggest examples is I had a woman, I used to work for a non-medical home care company, and we used to be her mother's caregiver. And it got to the point where she felt that a memory care unit would be more beneficial for her. So I helped her get into a memory care unit, her mom. And after about a week or two, I gave her a call. I said, hey, how's things going with mom? What's going on? And she said, actually pretty bad. She said that every time she sees her, she screams, she yells, she starts throwing things. And she said, she's not like that. I don't understand what's going on. So I kind of started probing her a little bit, and I asked her what was going on. And I said, are you going right after work? I said, things going on at work. And she said, yeah, it's been kind of crazy. I've had a lot of deadlines, and I see mom at 5:30 right after work. And I'm probably just not myself. So what I told her was, I said, this is what you need to do. I said, you need to go home every day. You need to maybe eat, take a shower, relax for a couple hours, have a cup of coffee, whatever you need to do, and then go there about 7. So a couple days later, she gives me a call back and said she has had the best visit in the last couple of days and she has in a long time. Reasoning behind that was she found out that she was so stressed out from work and so tired that when she went there, her mom could see that all over her face. She could see that she was upset, and the mom interpreted that she was upset with her, not interpreting that the daughter was upset, but she thought she was upset with her. So mom started getting upset and screaming and yelling at her. A lot of times I train, especially CNAs, because if they are taking care of 3 or 4 patients, and then they go to another patient and they're stressed out, they're tired, they're rushed, those feelings are going to show in that person's face and in their demeanor. So they're going to interpret it that something's going on with them. So they understand all types of nonverbal communication. Even if you don't think you're showing it, you probably are if they are starting to show some behaviors. Next screen. Emotions are highly contagious. The emotions they mirror will come back even stronger. So only bring emotions in the room that you want the person with dementia to display. So when I'm doing a lot of trainings, I tell them you have to fake it until you make it. So if you know you're having a hard time, you might need to stop, go get a drink of water, go splash your face, go take a time out for a while, whatever you need to do to get back in there to work with somebody and be a more understanding and cheerful and happy. Because if you show anything more than that than you're normal, they're going to understand and see that something's going on. So we need to check ourselves. We need to adjust our body language before each interaction. Before every care task, we need to check yourself. So if things go badly immediately, you need to check yourself again. We need to repeat this until this becomes a habit. Next screen. Nonverbal communication tip. Nonverbal communication is vital as verbal skills decrease. So as their verbal skills decrease, they're going to start not looking or not listening to your words. They're going to start looking at your face. They're going to start looking at your body language. Use gestures to clarify meanings. Use touch for activities and instructions. A lot of times as they are unable to tell you something, so if they are, maybe it's right before dinner and they are maybe angry or upset. You might ask them, are you thirsty? Are you hungry? And sometimes too, they might want, like if they are at a table and they're sitting down and you have forks and knives and all different things, they might get confused. You might have to break that down and only put a fork down so that they understand that they can use the fork to eat something. When they have too many things at once, it gets confusing to them. Another great example is I had a family member that used to always have problems in the morning getting mom dressed or helping her get dressed. And what she was doing was she was showing the whole closet and asking her what she wanted to wear. For mom, that was way too overwhelming. It was too many things. So what she started doing was taking one shirt or two shirts and two pairs of pants and then giving her that option of which one she wanted to wear. That was a little bit easier showing two things rather than showing a full closet full of things that was too overwhelming. Next screen. Why is behavioral communication occurring? Repetitive, difficult behavior may express an unmet need. We must interpret action to discover the underlying needs. Difficult dementia behavior is a form of communication. They start getting upset because they don't understand or are unable to communicate with you, or you're not unable to communicate with them because you are giving them sentences rather than breaking things down a little bit for them. Next. How to interpret behavioral supports. What personal preferences are being expressed? What is their behavior trying to tell you? What feelings or needs are they trying to reveal to you? Next screen. Wandering, here's some possible meanings. Lacking familiar places or faces. So as the disease progresses, a lot of times they'll wander and they'll say, I need to go home or I need to find my room. They don't remember where those things are anymore. They don't remember that this is their home that they lived in with their husband for 40 years. They're thinking now they're progressing back to when they were living with their mother or their father, and they're not understanding that this is their home. This is where they lived in for 40 years because they're thinking back 40 years ago in the home they used to live in. They feel out of place, they're bored or unaccepted. So a lot of times, especially in memory care units, they especially have activities all day long and they try and keep them not bored. So when they start getting bored, they start doing things, rummaging through closets or putting things in different places. So they like to keep them busy. And that's what they always say is keep them on a routine, keep them busy. And that way they're not going to feel bored and they're not going to wander. Next. So one of the biggest things is not all who wander are lost, meaning just because they're wandering around doesn't mean they're lost. It's just because they don't understand or don't remember where something is. Next screen. When someone living with dementia believes something to be true, it's true in their world, in the Alzheimer's world. So if they say that, like the girl, that one woman that said she threw the purse over the fence and lost her credit cards because there was a fight, she thought there was a fight. So in her world, there was a fight. In reality, there wasn't. Next screen. So meanings of agitation. You need to use the restroom, pain, fatigue, hunger, boredom, and anxiety. Those are all different reasons why they might become agitated. And they may not be able to express to you. That's why you'll ask them questions. Are you in pain? Are you hungry? Are you thirsty? Or you might ask them if they need to use the restroom. They might not remember how to tell you those things, but if you ask them or show them the restroom or show them a glass of water, they might be able to understand a little bit better and help them to not be so agitated. Next, meanings of no. So refusal of care, they want to still be in control. A lot of times they refuse because you're taking over and you don't want to take over. You still want to preserve as many abilities as they have. So if they're having a hard time tying their shoes today, well then maybe you can, maybe they could help with at least put their shoes on and you could assist that day with tying their shoes. I had a gentleman who had dementia and he was upset because he could no longer tie his shoes. So his wife got him a pair of Velcro shoes. That was easier for him to do, and he remembered it a lot easier than tying. So he felt more in control. So sometimes we have to think out of the box and do different things and still keep as much as possible for them to do things for themselves. There's a statistic out there that as we take over for them, their dementia will decrease more because they feel less worthy. And if you start taking everything over for them, they're not going to need to do anything, and their disease will progress faster. They also refuse because they may distrust you. They may not remember who you are. You're not explaining things to them. When you always used to give them showers, they were okay with that. Now they're not understanding that you're going to give them a shower, and the reason why they need a shower to keep clean, maybe because they're dirty, or because they need to wash their hair because it's been a while. They're distrusting because they're worried about those things, because they don't remember the things they have to do. They feel disrespected because you're helping them more and they're used to doing things themselves, and they don't remember or understand why they don't remember, so they feel you're disrespecting them. They're fearful. A lot of times they think if they don't remember who a family member is, they become fearful. They may say, leave me alone, no, go away, I don't want to. You have to clarify, you have to work with them, you have to think of different ways in order to do those care tasks with them, or to help them eat their food. Maybe a fork or a knife or something maybe different. So a lot of times we have to think outside of the box, and they're saying no because they may not understand what's going on or understand you. Next. Meanings of repetitive behavior. What time is it? Isn't it time for me to eat? I haven't eaten all day. I should remember how to do this, but I don't. When can I go home? This is not my home. Help me, please. Someone help me. Again, if they repeat those things because they don't remember they've eaten all day, they don't remember that this is their home, but they're thinking that it's their home that they lived in long ago. Repetitive words or actions. Sensory self-stimulation. A lot of times they will like grab their shirt and just rub their shirt. Sometimes they just like that stimulation of doing that. Or they may go up to somebody and start rubbing their arm or their shirt because they like the feel of their shirt. Anxiety, that tends to increase as the disease progresses, of course, because they're not understanding what's going on. They're not understanding how to communicate to others. Reassuring habit, search for meanings and purpose. So a lot of times they're trying to ask you what time is it, or maybe they're asking you where's my home at, because they're searching for the meanings and they're searching for purpose and they're searching for where they think they live because they don't remember. Next. Verbal communication. They aren't trying to be uncooperative, they just feel like a failure. They are doing their best. They can't remember how to do something, and they believe you're the one who's confused. So a lot of times I've told family members when someone said, oh, I don't know how to tie my shoes, you work with them and you say, okay, let's see what else we can do. Let's see if you can put your shoes on. Or if they start talking about Aunt Sally who died 20 years ago, your best bet is to talk with them and say, oh yeah, Aunt Sally went to the store. She'll be back a little bit later. I always tell family members not to say Aunt Sally died 20 years ago because she doesn't remember that. And she may start getting angry that she wasn't invited to the funeral, or why she hasn't been able to see the gravesite, or why no one told her. So a lot of times you have to kind of go in their own reality. And sometimes you have to start talking about different things. She went to the store. She'll be back. We need milk and bread. So you have to kind of go around it and redirect them to something else. And that's not to say they're going to come back to that, but at least you can redirect them to something else. But I would never tell them, unfortunately, it was called fiblets. We might have to tell them not the truth because it may get them upset. Next, verbal communication. We have to break things down in smaller steps. So we give one small direction at a time. So this example is there's a shirt on one side and a pants on the other side. So sometimes we have to give them a shirt and a pair of pants, or two shirts and two pairs of pants, and they get to choose what they would like to wear. They still want to have choices, so give them those choices, but just don't show them a whole room full of clothes or show them a whole closet full of clothes. Next step, next screen. More on verbal communication. Requests from a person with dementia might include language difficulties, so they might say the wrong words. So many times if you don't understand what they're saying, what you would do is ask them, can you show me what you're talking about? Can you point to what you're talking about? A lot of times as the disease progresses, sometimes we would do cards with them that have pictures of clothes or pictures of a knife and fork or a water bottle, things like that. So a lot of times we can show them those and they could point to what exactly they're trying to say. They often mix up their words and sometimes they're hard to understand. So on the bottom there it says, why is this so difficult to understand? A lot of times family members try and argue with someone And that is one of the things we shouldn't do. We should just agree with them, work around that. We should have them help us understand what they're trying to say. Next. Learn to continue to check yourself. Use gestures and touch to clarify what you want them to do. So a lot of times, especially in assisted living facilities or long-term care facilities and nursing facilities, a lot of the caregivers, the CNAs and nurses and stuff have to let them know, hi, Sandy, we are going to take a shower now. Let's get your body soap and let's get your clothes. So you do one step at a time. Bring them into the shower. Say, I'm going to help you wash your arms. Can you help me wash your arms? You do one step at a time. Can you tell me more about it? There's a fork. They may have to show you a fork or a knife or whatever. Ask them what they're asking. Ask them what they want. Can you show me or point to what you want? What is it used for? Ask them some questions so that they can maybe remember or point to something. Next. Important communication tips to remember. Approach from the front but a little to one side, supporting and not confronting. If you approach from the back, they might get paranoid, think someone's after them, think someone's going to hurt them. Use their preferred name or their name they are going by now, maybe a nickname from the past. Remember, they start progressing towards the past. If their actual name is Elizabeth, but they were called Lizzie back in the day, they might prefer Lizzie now because they don't remember Elizabeth is what she's been using for the last 20 or 30 years. Use simple language and gentle words. Use 1 or 2 word answers. Often yes or no questions are the best. Next. Communication becomes more difficult as disease progresses. So again, use yes or no questions. Avoid saying no, can't, I already told you this. Like I said, we have to just kind of go with the flow with them, talk with them, help them understand. Simplify choices, but don't eliminate them. Ask one question at a time. Next, what can you control or not? So you can control the environment, settings, sounds, and sights. A lot of times as disease progresses, they have issues with too much lighting, too much music, too many people in a room. A lot of times, especially during the holidays, it's very overwhelming for them to have a room full of all the nieces and nephews and grandkids and everything like that. A lot of times what I tell family members is you might have to have them in a different room and have 1 or 2 people or 3 or 4 max to go in there and talk with them because too many people is too overwhelming for them. How the help helps. Approach behaviors, words, and actions and reactions. So when you're helping them, you have to approach and make sure that your body language is showing that you're not antagonizing or that you're not stopping them from doing things themselves. So you have to always watch your body language. Make sure that you're happy-go-lucky and you're faking it till you make it. Not control. The person and who they have been, personality, preferences, and history. They don't have any control of that because they're regressing back to what was before. So they may regress to their childhood, so they may not be able to verbalize things. One of the biggest things I hear a lot from family members is my mom is swearing like a truck driver. She never used to swear a day in her life. But I always tell them, remember, back in the day, even when you were a kid, you were always told, don't say the word, it's a bad word. But as the disease progresses, that filter has gone away. So those words that they were told never to use, now they use them because they don't understand that those are not so nice words. The level of dementia is now. They don't have control of the capabilities that they're losing. Other medical conditions and sensory status. A lot of times they have no control of other medical conditions that may occur, like such as heart diseases, or maybe they might have congestive heart failure or COPD or things like that. A lot of times that plays into effect of their control of their dementia because they're also not feeling very well and they may feel like they're in pain. Next. Encourage engagement. So ask a person to try to do something. Ask a person to help you. Oftentimes, maybe there is somebody who'd love to cook, but she can't cook. We're really worried about that because of her sticking her hands in the oven and pulling things out without a hot mitt. So still have them mix the food or maybe set the table. Still make them feel that they're worth and be able to do things. Give simple, positive directions and, like I said, one step at a time. Use props or objects, gesture, demonstrate to them, guide them, distract them, and redirect them if they seem to be in a harmful behavior or if they continue to repeat. You can just distract them or redirect them into something else. Next, communication tips. Break your instructions and your communication down into steps. Yes or no questions are definitely best. Use concise, simple, but not childlike or condescending language. Still talk to them like you normally would. Be patient and calm. Your nonverbal cues and emotions can often be felt by the person and may be more powerful than your words. Do not argue with the person. Understand that what they are feeling or saying may be their reality. Use yes and statements. So, for example, if a person's concerned about needing to go home, say, yes, I understand you're worried about that. And perhaps we can go over here and grab a drink and then talk about it. Find out what we can do. Be attentive, show interest, reinforcement, even if you're having some trouble understanding. Laughter and kindness go a long way. Music goes a long way. Use cues such as demonstrating or showing along with verbal instructions or information. Let them show you what they're talking about. Maybe show them different things so that they can point to what they're trying to express to you. Next, 10 tips for dementia caregivers. Make life as normal as possible for as long as possible. Encourage her to play for the future or plan for the future. Ensure that she remains healthy. Make sure they're drinking. Make sure they're eating as much as possible. Even if it's just a few bites or a granola bar, if that's all they want, just keep trying to get them to eat and drink things. Take her for health checks. Consider underlying reasons for changes in behavior. Accept professional help. We'll talk a little bit more about professional options for families. Continue to be involved when she enters residential care. If they wind up in a memory care unit, make sure you still see them. Think about end-of-life care. Look after yourself and take a break. Next, 10 commandments. I am still me. In other words, they are still who they are. They're just a little bit different. Their personalities may be different, but their memories may be going back and regressing. I always tell families, they're still the person on the outside. They're just having a hard time with the person that they are on the inside. Treat me like an adult. My behavior may be childlike, but never treat them like an adult. No baby talk. Come into my world. I can't function in yours. So you have to get into their reality. You have to get into what they're trying to understand. Actions are better than words. No big explanations. Gentle touch, hug, warm smile goes a long way. Give me daily consistent schedule. One of the biggest things they always say for memory patients, anyone with dementia, is to have a schedule. Consistent. Wake up at 8 o'clock, have breakfast at 8:15, take your medications, schedule all day long, something. And that way it's very consistent. Next, give me nature. Take them outside, show them sunshine, hang out on the porch, go for walks. They still love doing those different things. And hopefully, and if they like to garden, still take them out there to do those different things. Give me pleasure activities. They may forget that they went out to lunch before, or they can go fishing, but you could still show them pictures, or you could show them TV shows or things like that. Give me social interaction on my terms. I can't handle large gatherings, but like I said, take them into a room and have only a few kids come in at a time. Keep me safe, especially from wandering or touching the stove. Those are the biggest things. Keep me healthy. Help them to eat their foods, drink, take them to doctor's appointments, things like that. Next, 10 practical care tips to use when caring for a loved one. Establish a daily routine. Maintain hydration. Make sure they keep drinking. Urinary tract infections are huge with the elderly, especially dementia, because they forget to drink. So make sure they stay hydrated. Effectively communicate. Keep communication simple. Ask one question at a time. Yes or no questions are best. Focus on their feelings rather than facts. Promote positive feelings at all times. You have to be positive and help to keep them positive. Keep them with their interests. One of the biggest things that they love playing cards but don't remember how to do in the usual way. Do things like show me the red card, show me the cards with one on them. You can do those different type of things. You can still kind of play cards, but not in a normal way. Next, be aware of family relationships. Positive feelings encourage greater acceptance of care. Avoid tension within family. A lot of times family members all don't understand about the dementia process. You guys have to keep educating yourselves and keep getting help for each other, and make sure that everybody, if they're taking care of mom, understand the routines and understand what's going on. Taking care of yourself, you need to understand your own limits, if possible. There's definitely caregiver burnout because they get tired, they forget to do things, not getting enough rest. So that's huge in order to take care of yourself. Join your loved one's personal reality. Like I said, get in their moment. If they are talking about 1925, sit and listen because you might hear some great stories. Don't argue about incorrect facts. And Aunt Joan died 20 years ago. Just agree with her or say she went out to the store. Read between the lines. So nonverbal communication often says there's some verbal language failures. They're not understanding what you're talking about. So you need to make sure you're reading between the lines and what's going on. Check yourself. They can read your body language, so make sure you check yourself that you are understanding that they're not understanding you. Seek ongoing education and support. We'll talk a little bit about that in a few minutes. Next. So quickly, which table setting is best? Of course, everyone, and I don't even use half of those. That's kind of funny. But of course, the one on the right's better because that's pretty overwhelming. All those different spoons and knives and plates and things like that. One plate's plenty for them, and one spoon or fork. It's definitely fine with them. They get very not understanding because of the fact that there's too many utensils on there. They might get a little overwhelmed. Next. Here's some resources. Alzheimer's Association has a 24/7 helpline. Their website is www.als.org. I can send you these things later if you guys would like. There's also a free webinar held by Comfort Care, Home Care. They are nationwide. It's a webinar that's held monthly every third Tuesday of the month at 7 p.m. Eastern Time or 6 p.m. Central Time. Deborah Beer, PhD, she is a part of their Dementia Wise program that teaches 8.5 hours to all their caregivers. And she keeps up with all the different dementia things that are happening in the Alzheimer's world. And each third Tuesday, she gives some different options. She might talk about different medications that are out there now, or she might talk about different care tips and new things that are coming out. So that's a great resource. And I have a 12-minute video, but I think we are getting towards the end. If anybody wants, this is a great video if you guys want to write this down. This was actually done by 2020, about 5 years ago, and it goes for 12 minutes, and it's Diane Sawyer and another gentleman who actually was in there, and they did different things of closing their eyes, giving them all this noise and things like that. It's a great video to watch because it shows what is going in the mind of someone with dementia. Next, 10 Commandments of Caregiving. Never argue, instead agree. Never reason, instead divert. Never shame, instead distract. Never lecture, instead reassure. Never say remember, instead reminisce. Never say I told you, instead repeat. Never say you can't, instead say do what you can. Never command or demand, instead ask or model, show me. Never condescend, instead encourage and praise them. Never force, instead reinforce. Next. Remember, the dementia Alzheimer's patient is not giving you a hard time. The dementia Alzheimer's patient is having a hard time. Thank you all for attending. If anyone has any questions, let me know. I hope this was beneficial for everyone.
Okay, thank you, Mary. Right now I'm not seeing any questions, so I will give a few minutes in case people are writing something. We did get one comment that said wonderful for your presentation, and I think the information was very helpful and a good reminder of what we need to remember when we're dealing with somebody with dementia.
Okay, great. And like I said, I can send you guys those the website and also to the resources if anyone's interested.
Okay. Those that are Advocacy Link staff, they'll be able to access the PowerPoint on our real staff section, so they can get that information through that.
Great.
So, okay. Got another comment. Thank you, Mary. Very helpful. So, okay. I'm just going to give another. Not sure what this dementia last. Okay. Not sure what that's about. So if that person that said dementia last with a question mark wants to shoot me some more, I'm not sure what you're trying to say. So.
Are they referring to how long between diagnosis and how long does the person
Oh, I
pass
think you're
away?
right. How long can the first stage of dementia last? There it is. I got the full question. Thank you.
Okay. Well, normally within 10 years. So if someone's diagnosed today, they have about 10 years, anywhere from 7 to 10 years.
Okay.
And currently, they say dementia usually be 65 and older. We have been getting more and more cases as young as 50 and 60,
Okay.
unfortunately. So, and ones that get diagnosed early on in the 50s and early 60s tend to maybe be around more the 7-year mark. As well, if someone's later on, like after 65, normally it's about 10 years.
Okay. Here's another one. Is there a difference between Alzheimer's and dementia other than parts of, I can't see it all, other than parts of the brain that are affected?
Yeah, what it is with dementia is kind of like I said, the umbrella. That is the main diagnosis is dementia. And then there's like the different spokes are different other types. So like frontal lobe is more towards the front. Something like vascular is more due to blood issues, maybe because of heart conditions and things like that. That's more vascular. So those things have a tendency of any of those ones affect the brains differently. Eventually, it affects the whole brain, but something like I said, like and Alzheimer's has a tendency of just being sporadic. It's not one part of the brain or another. It's kind of sporadic. I hope that clarifies.
Okay. All right. We got some good questions. Trying to make sure I'm not overlooking anybody. Let's see. And yes, the person responded awesome to your
Okay.
answer. It helped.
Okay.
So, uh, okay. We're almost at 4 o'clock, so I'm just trying to make sure nobody has other questions. Oh, wait, there's one more here. Are there different demographics that have a higher rate of dementia?
Um, Actually, like if you're talking about race, not really. Women tend to get dementia more so than men. That's the biggest demographic. There's also
Really?
been women get it more than men. Um, there's a lot of theories out there, just like why is dementia so much more pronounced? A lot of times now they're saying there's a lot more due to medications that people are on. They're thinking because of the foods, like they're thinking possibly a lot of the processed foods and different kind of pesticides and things like that are out there. Like I said, there's lots of theories. There isn't anything really concrete. One of the biggest things that they're saying, more people will get dementia because of hearing loss. So if people don't take care of their hearing and don't get hearing aids like they do, people have a tendency of getting dementia if their hearing is not 100%, if they have quite a bit of hearing loss. So there's a lot of
Okay.
statistics out there.
Okay. Right. Any other, I'm not seeing other questions unless I've overlooked someone. I don't want to hold people up. I appreciate everybody's time again. Okay. All right. I'm just going to give about 30 seconds, and then if there's no more questions, we're
Okay,
going to go ahead and log off.
great.
So,
Sounds good. Thanks, everyone.
yeah. Yeah. Again, Mary, thank you for the
Oh, you're
presentation.
very
Very
welcome.
interesting.
Yeah,
So,
and you have my email, so if anything ever comes up or anyone has any questions, feel free to, email me. If they ever
sure.
have any, clients or patients that need any time of hospice, I'd be more than happy to help. Well, I mean, just sometimes to talk, it's kind of funny how
Right.
families get to that point and they don't even want to talk about it.
Right. Right. You're right. So, okay. I don't see any other questions coming through. So I'm going to
Great.
let everybody get back to their afternoon. Thanks, Mary. And I'm
Okay,
going to
absolutely.
stop the presentation. So,
All right, sounds great. Thank you.
all right.
Okay,
Thank you,
bye-bye.
everybody. Bye.